Welcome to this video. In the next few minutes, we will show you how to safely and easily perform a drainage using the Evermed Reservoir Drainage Set. Before you begin the procedure, make sure to prepare the following essential materials: the drainage set, an alcohol-based surface disinfectant, a hand disinfectant, and a pair of disposable gloves for safety and hygiene. Begin by preparing a clear workspace on a table and thoroughly disinfect it using an effective surface disinfectant. Please wash and thoroughly disinfect your hands using soap and water and then put on the gloves. You have either a short catheter, which is clearly visible on the left side of the image, or a longer catheter that is neatly rolled up on the slit compress located on the right side. The following drainage instructions apply to both options. First of all, carefully remove the dressing that covers the catheter. Please exercise caution and avoid tugging on the catheter. Always avoid using scissors or any other types of tools for this particular task. If you notice any signs of redness, swelling, or fluid accumulation, please inform your treating physician as soon as possible for prompt attention. Then remove the gloves and thoroughly disinfect your hands again to ensure cleanliness and safety. Please open the drainage set and then set the reservoir aside for later use. Open the dressing material set and gently spread out the blue drape, ensuring that the flap is facing upward. Please exercise caution and avoid touching the inner surface of the drape. Grab the gloves by the opening and then gently put them on your hands. Make certain that no unsterile objects are touched or handled with the sterile glove during the procedure. Open the packaging of the alcohol swabs without actually removing any swabs from them. Gently and carefully remove the silicone or protective cap from the catheter and dispose of it properly and responsibly. Insert the safety valve into the packaging of the alcohol swab, then clean it with gentle twisting motions. Please allow the disinfection process to take full effect for a duration of 30 seconds. Now remove the reservoir from its packaging. Make sure that the access tip stays completely sterile while it is connected to the tube. Then close the clamp securely on the connection tube. Remove the protective cover from the access tip, which may require a gentle twisting motion. Then remove the alcohol swab from the safety valve and gently insert the access tip into the valve. You can hear and feel it click into place. Then squeeze the reservoir and remove the bright orange safety device. Now open the clamp. The drainage begins. To shorten the drainage time, it is advisable to place the reservoir at a lower position, such as directly on the floor during the drainage process. If you experience a strong pulling sensation during the drainage process, briefly close the clamp to pause the drainage for a moment. If there is severe pain, please stop the drainage procedure completely. After completing the drainage process, close the clamp again. Then disconnect the safety valve from the connection tube. Place the safety valve back into the packaging of an alcohol swab and then thoroughly clean it again with a recommended time of 30 seconds for effective sanitization. Now open the packaging of the protective cap from the dressing set and let it fall onto the clean blue cloth. Securely attach the protective cap to the safety valve. Read the drainage amount indicated on the upper holding knob and accurately document it in your drainage record. Before we begin applying the new dressing, choose the most suitable instructional video for your specific catheter type. You can easily identify the correct video by looking at the thumbnail, which prominently displays the corresponding catheter. You will still need to keep all the utensils you prepared in this step for the upcoming stages of the process.